Hi, I'm Dr. Dawson. Today I'd like us to talk a little bit about stomach bugs, specifically vomiting, diarrhea, dehydration. These are challenges that we're all going to face, and I'd like for us to understand them a little bit better. So first of all, when I'm talking about a stomach bug, I'm talking about a stomach virus. 98% of stomach bugs are caused by viruses, and so that's what we're going to talk about today. We'll worry about the other 2% later. So your average stomach bug will start off with vomiting. Not my favorite symptom, because it seemed like most of my time when my children, when they vomited for the first time with an illness, it was when I would get home from work and pick them up and put them on my shoulder, and then they would vomit all over me. But nonetheless, that's how most stomach bugs start. And I would say that probably 95% of vomiting is caused from stomach viruses. Now, things I want you to at least think about before just assuming it's a stomach virus. Number one, did my child just hit their head really hard? And I'm not talking about did they fall down and hit their head on the concrete. God designed small children so that they can fall from a standing height and hit their head on concrete without being significantly damaged. I'm talking about a big head injury where they either got knocked out or nearly got knocked out. So that'd be number one. Number two, could they have just gotten into poison or something like that that could be causing the vomiting? Certainly you'd want to consider that before just assuming it was a virus. Number three, and this I think is something that's perhaps gets more than a share of the blame, could it have been food poisoning? Could they have just had a meal that was not adequately refrigerated or whatever? Usually that kind of vomiting starts, about 6 hours or so, 4 to 6 hours after they've had that meal. And so that would be something that you would probably suspect, but highly overrated. And then the fourth would be, are they having a lot of pain or bloating or some evidence that maybe there's some obstruction in their gut that's causing the vomiting? But if those things aren't present, we can start off by treating it as if it's just kind of your typical stomach virus kind of vomiting. And the way your average stomach bug goes, the first 12 to 24 hours is when the vomiting will occur. Somewhere during that first 24 hours, the diarrhea will start, and it'll last from 2 to up to 14 days. So that's the course of your average stomach bug. But let's talk a little bit about how does a stomach bug work and how does it affect your gut. So I've made you a lovely picture here. This is the picture of a portion of your gut, and most of the time, your gut is lined and are grown in this lovely shag carpet. So you have these long villi that come up from the edges, and that gives you more surface area where you can absorb more fluids. And it's just like shag carpet. It absorbs almost everything, will just be absorbed by that. Now, what happens the first few hours of a stomach bug is the virus goes through and it mows down the shag carpet. So now what you have is sort of indoor-outdoor carpet or linoleum, and it doesn't absorb anything, and so everything just starts to slide through, and that's why you have the diarrhea. Everything is sliding through. About the only thing that this indoor-outdoor carpet and linoleum will absorb is maybe a little bit of Pedialyte or small amounts of clear fluid, and that's why we give those things at first. In another 2 days, you'll start to get some regrowth of the shag, and it will start getting bigger and bigger. But at this point, this area here is really pretty raw. All this acidic stool is sliding through. And if you've ever had a baby with diarrhea, if you look around their little anus where all this diarrhea is coming out, it will get red and raw and irritated. And if you take how red and raw their little anus is and multiply it times 5, that's what the inside of their gut looks like. So it's pretty raw. So sometimes at this point, to help them heal, I'll give a little bit of an old-fashioned medicine like Maalox or Mylanta, maybe a teaspoon or two. They'll just cut down on the acid so that, the stomach acid just kind of tears that up when it's trying to regrow it so raw. So that'll sometimes help it regrow a little better. And the same thing, it'll help with what's coming out the other end at their bottom. It won't burn their bottom as bad either. After this continues to grow, at some point we'll get where we have the regular normal villi back. And then at the very tips of it, in the pit house of the shag, is where the little guys live that digest dairy. So they are the very last thing to come back. They're at the very tip, and that's why frequently we wait on dairy till the very end of the illness, and we'll talk more about that in just a second. So it starts out with shag, gets mowed down to indoor-outdoor carpet and linoleum where everything slides through. You start growing over the next few days to weeks some new shag that's very raw, but we have to feed it in order for it to grow. We can't just give Pedialyte because we need some calories for this part of their to grow, but we'll talk about that from just a second. So, first of all, what do we do about the vomiting as far as how do we treat it? The main thing we'll do those first few hours is just give them a small amount of fluid at a time. My favorite thing to give in this situation is popsicles because it's just clear fluid, but you can only drink a little bit at a time because it's frozen. Also, it has a little bit of sugar in it. A lot of times people talk about giving them a clear fluid like water, but water doesn't have any calories in it. And over the next few days, we're going to be wanting to get some calories in them. So I would rather give them a clear fluid that has some calories in it. And so in this case, popsicles fits the bill. And even though when they get where they're feeling a little bit better in between vomiting, they sometimes may want to drink, try not to give them very much because sometimes they're a little thirsty. They'll drink a bunch. It stretches their poor little stomach out. And then you sort of have Mount Vesuvius and everything comes up again. So even though they sometimes want to drink a bunch, just tiny bits at a time. We probably don't have to worry about Pedialyte right here at first. Any other clear fluid would be fine. Pedialyte is more important to replace the fluids you lose when you're having the diarrhea, and so that'll come into play a little bit later. Also, vomiting is not particularly prone to make a person dehydrated. When you vomit, all you lose is what's in your stomach, and that's usually not enough fluid to cause anyone problems. Dehydration usually comes from when we lose fluids with a lot of diarrhea. When you're having more than 6 to 8 diarrheas a day, then we have to start worrying about, can we replace those fluids, quickly enough. So I have to throw in, I try to go out of my way to not endorse any products or anything like that in these videos. But I have to say that the folks that discovered Zofran, which is the medicine that we can now give to diminish vomiting, has probably been the thing that changed the day-to-day management of my pediatric practice probably more than anything over the last 40 years. So I have to say that that's been a blessing. Used to, we just had to wait for the vomiting to stop. And now having the ability to give Zofran when they're having a lot of bad vomiting has really been a blessing. There again, that's something you'd need to talk to your doctor about. All right, so let's talk about dehydration a little bit. How can you tell if your child is getting dehydrated? If you look on the internet, it talks a lot about pinching their skin and seeing how quickly it goes back, pushing on their eyeballs to see if they feel firm enough. All those things are a waste of time. Your average mom doesn't poke on enough eyeballs on a regular day to know what regular eyeballs are supposed to feel like. And the same thing goes for tinting skin. The only way to tell if your child is dehydrated or not is by sticking your finger in their mouth. If you stick their finger in their mouth and you get a wet finger back, your child is adequately hydrated. If it's sort of dry and pasty like a cat's mouth, then that's a sign that maybe we're getting a little behind and we need to push harder on the Pedialyte or perhaps get in contact with your doc. So sticking your finger in your mouth. Now, I will say you don't always have to stick your finger in their mouth. And if they have a stomach bug, that's a really good way for you to catch the stomach bug yourself. Sometimes you can just look in their mouth. And if it looks like it'd be a wet finger coming back, virtual testing will be good enough in that situation. So dry and pasty like a cat's mouth, more Pedialyte, maybe give your doctor a call. So for the diarrhea portion, as we talked about from the lovely picture I showed you, you mainly just have to wait. It's going to take a while for that shag carpet to grow back in. So what we do at first, we'll give just small, once they get to where they're feeling better. Now the first 6 to 8 hours, we're just helping them with the vomiting. But once we start to feed them a little bit again, probably at the 6 to 8 hour mark, just very small amounts of food at a time. We used to give the BRAT diet, which stood for B was for bananas, R was for rice, A was for applesauce, and T was for toast. And those were considered bland foods that would help. It probably doesn't matter that much what the foods are. The more important thing is to give small amounts at a time so that that little healing gut can use those calories to grow, but not so much that it overwhelms it and it just increases the amount of diarrhea that they have. So small amounts frequently. As we discussed, sometimes a teaspoon or two of Maalox or Mylanta may help keep the stomach acids from causing more harm than good in that portion of the gut. Probiotics may help a little bit, but essentially you're just going to have to wait a few days for the gut to start to grow back. So to kind of recap a little bit, how do we treat stomach bugs? The first 1 or 2 hours when they're at their sickest and the virus is going through destroying the shag carpet, sometimes just let them sit there. You don't have to start immediately trying to push fluids and popsicles and all that stuff in them. A lot of times those first few hours, they just want to sit still and try not to throw up. And so it's okay to just leave them alone, for the first few hours. But then we want to get started with a little bit of the popsicles and those kind of things. After 6 to 8 hours, maybe some of the bland foods, as we discussed, just very, very small amounts at a time while we wait for the stomach bug to go away. And it's not uncommon for it to take a little while. Sometimes up to 2 weeks of diarrhea can be expected with a stomach virus. So we're going to check and make sure that their mouth stays wet and that they're not getting dehydrated. But the main things will be patient to let the gut grow back. We would want to let the doctor know if we had persisting vomiting, if we had significant pain, or if it seemed like the diarrhea is going on for more than a couple of weeks. Those would be things your doctor would want to know about. Other things you might want to let your doctor know about is if you saw more than just small flecks of blood, that would be something their office would probably want to know about also. So that's how stomach bugs work, and I hope that helps.